Hi, everybody. I do hope you're well. Welcome to Homeopathic Voices from around the world, and this is episode 9. And I'm absolutely delighted for two reasons. The first one is there were no technical issues with Instagram Live, so woohoo! And the second one is that I'm delighted to welcome Dr. Jitesh Sharma, who works at the JDS Homeopathic Hospital. So, Dr. Sahib, thank you and welcome with open arms, a virtual hug.
Thank you. Thank you so much for inviting me and giving me opportunity. And I'm so glad uh, that I got a chance to speak. And I believe you're doing really awesome, and I would must appreciate your hard work. And I have seen you have been inviting so many people around the world, and just to spread homeopathy. And it's very delighted to know, and we are very grateful to you and for your hard work. So please accept my gratefulness and thanks for all your efforts, what you do. Thank you so much.
That's very, very kind of you, Dr. Jitesh Sharma. Um, the objective of the podcast, which I do, and the objective of Homeopathic Voices is really to gather everybody, homeopaths, MDs, researchers, authors, teachers, lecturers, students, graduates, even the home prescribers, because it's now becoming a very big, big community. And I firmly believe that 2024 is the year of homeopathy. And, let's work together and really push it forward, so people are aware that this amazing system of medicine, this healing system, curative system is there,
Definitely, definitely.
So I must say I've been following you on your socials, and I'm just surprised you get time actually to put yourself on socials, because the work that you're doing is truly very commendable indeed. So as this is the first part, this is part one for the listeners of several parts with Dr. Jitesh Sharma. I wanted to, for the purpose of the benefit of the listeners, if you just introduce yourself so everyone is aware who you are, where you're based, and about the
Yeah,
hospital.
definitely. Myself, Dr. Jitesh Sharma, I'm an MD homeopath, and I'm based in India. There's a place called Odisha, there's a state,
Mm.
and I have my own hospital, which is a 30-bedded hospital, and we work on completely, we don't use any saline, any injections, we use on completely homeopathic medicine here. And we have I have been trained under more than 38 teachers around the world. I have studied with many classical stalwarts
Mm.
of homeopaths, and after that we I decided to pursue this, and it was also my dream to run an hospital, because homeopathy needs like immediate effects, right? And we cannot claim that it takes a lot of time, it takes this, because that myth has to be broken, because that is actually degrading it in a different way. What It's like it becomes mockery that he will take pills today and he'll get all right on next year.
Mm.
So we become a part of mockery. So that's the thing. We have started breaking the myths here itself, and believe me, I have been doing best of best homeopathy what I can do, and according to my understanding, and practicing aphorism like 247, 248, and 272 very religiously, what has been written in. And so that is Organ's 6th edition very precisely, because around the world, if you see, there are different people who are just biased and they follow only 4th edition. There are few people who practice only 4th edition of Organon. There are few people who practice about 5th edition only. So we practice strongly 6th edition, how it is. And we practices more of LM potencies, which has been a marvelous boon in homeopathy, which I can say what Hahnemann has written in aphorism 246 footnote, that it is my most altered and most perfected method. So that line, what Hahnemann has written, that was the concluding of everything what every homeopath is doing. And I believe if everyone can do, if I can get results in 20 minutes, everyone can do. I'm not doing something very different. Like I have posted a lot of videos before and after. And what we do, that we make the patient sit here itself and you take the medicine. Either it will be chronic or either it's acute. It
mm,
doesn't matter. So master doctor professor Pradeep Gupta sir, like he used to say that no patient is acute or chronic, Jitesh. It depends at what scenario he comes to you. He demands at that time. So how would you say it is acute or chronic at that moment? So
then,
that way.
yeah.
So I have been established here, and we have been very religiously working, like how homeopathy is showing people that yes, within 20 minutes, within 40 minutes, you can see the results spontaneously here itself, that how homeopathy works fast. So that myth we have actually broken long ago, and thanks to my teachers, like, and I'm very grateful that we have been working very hard with my team, and I'm very blessed with a very good team of mine. I have like around 8 to 10 doctors around me. They have been trained well, and they have been working hard. We also run a training center here, like, or around the world. All come and they get trained for 6 months here for classical training. They are here. So what happens, I'll tell you, it's not like online thing. It's like practical thing sitting next to me. You yourself make the medicine, you yourself give to the patient, and then you ask yourself in 20 minutes. Then that self satisfaction it's different, right? Like, I am practicing, I am doing it, that is fine. But when that particular homeopath, he himself does it by its own hands, that gives him immense confidence in himself. Yes, this is something I can also do.
Mm,
So that level of confidence is required in homeopathy. That's why many people get disheartened that he some big doctor can do, I cannot. No, they are big people, they are practicing very good, I can. So that he should not. Everybody's same. I believe everybody's same, and everybody has failures. By learning from so many stalwarts, I have seen the topmost doctor has many failures. And because we have failures, we have a dedication to work hard, to improvise ourselves and do something good.
You know, you mentioned something very, 2 points which I'd like to touch upon. The first one is LM potencies. But just before I go to that, I would say that, when I look at homeopathy, I always speak, whoever I speak to, whether I'm delivering a lecture, whether I'm doing a podcast, whatever it is, homeopathy is one part within the umbrella of service to humanity. But right at the top of that service to humanity, near the top, certainly, is having a hospital and being able to serve humanity through a homeopathic hospital. So, congratulations to you, because I think it's very inspiring indeed, where people can physically go, and it's a hospital environment. Certainly, everybody is used to that in our modern age that we live in, advanced technological medical age that we are in. So yeah, I just wanted to say congratulations to that, and may God bless you in abundance, with what you're continuing to do.
Thank you.
Now, Dr. Sharma, I wanted to ask you actually about LM potencies, because I use LM potencies, absolutely amazing. And for mental health conditions or emotional imbalances, oh my God, the results are just so profound. I'm shocked sometimes. I've been in this profession many years like you, and I'm thinking,
Same with me when I
wow.
started.
Huh?
I was just unbelievable.
It's amazing, isn't it? The results. Share the results, because I know that many who are listening or will listen back, of course, may not be aware of LM potencies, but they are so deep acting and so gentle. It's just amazing how something so gentle can have such a huge ripple to manifest and to help somebody restoration of health, right?
So I will share one of my life's best case till now. I have many, but this was something hit very hard,
Okay.
and I was not expecting that LM can work so fast, like so fast. I had a case of dermoid cyst or hemorrhagic cyst, right ovarian cyst, hemorrhagic, and it was around 52 mm. 52 mm.
Hmm.
So she was recommended to a surgeon to get it operated immediately, and they did went to her. They in fact heard my name and they came me to my hospital, and we started the treatment, and we took all the history, and we found out there's a lot of jealousy, was very much revengeful attitude, and very much burning, stinging pains. Of
Hmm.
course, the remedy is epismel, and I gave epismel LM1. I started right away here itself, and she started feeling a bit better. I told, okay, you go home, you take it, and we'll see how it goes. And within 8 days, she did her mother was so anxious that, oh my God, she was just a 13-year-old girl. So she was very much worried about it. And she was so anxious. I called her after 1 month. And that mother was so anxious. They did an ultrasound on 8 days after, and they brought it here and said ki, sir, she's totally fine, and see the report. The radiologist also asking your number. How did you treated this? And there was no cyst. And like few days back also, like she has sent me a lot of patients after that, even the radiologist. Like I was astonished to see in just 9 days 52 hemorrhagic cyst is just gone. And that child was in such agony, such of burning pain down in the hook, extending downwards and everything. She was in such agony that relieved like within few hours. And I was just thinking that, like the homeopathy is so deep that it will take, I think, many lives to understand what power we actually have in our hands if we use in a right way. And
Absolutely.
I strongly feel myself as just a drop in the ocean. I'm just a drop in the ocean. It We have a humongous humongous knowledge in homeopathy if we read it right and have a good attitude. First, being humble. Nobody is elder and nobody is taller. That is the attitude first we usually keep that. Then only you will see. I have seen many stalwarts have been very grounded, and they're sitting with like junior physicians, and they're sitting, boss, please teach me how you're doing it. I also want to learn. That attitude actually makes you more better homeopath. So this way, I have seen it has been huge impact of LM potencies, even in acute sciaticas. So usually what happens, everybody thinks that if you give LM and this, there will be a strong aggravation, then followed by amelioration. It not happens with every cases. We need to see that how anxious that patient is, how's the vitality of the patient is, then you decide that we should give LM or not. So in acute sciaticas also, if I find that that's the modalities and everything, I give in LM, and within 20 minutes that patient is absolutely fine. I'll share today's morning case. That patient is of female patient, coughing since long. She has lot of chest pain while coughing, typically dry cough, you know, and she was very emaciated, very emaciated, dry cough which is not at all going away, and she has lot of weakness inside, lot of, and she was coughing. I gave bromium 30 4 doses, and she was coughing since 15 days. In 4 doses that case got resolved here itself, and I made them wait for 2 hours to see if that patient is coughing or not. And the patient told herself that I'm 90% better. So
You know, that's the real power, isn't it, of homeopathy? When that remedy matches,
it
my God, it's absolutely phenomenal, isn't it?
and since you're from London, I would like to say Marguerite Blackie, Peter Fisher.
Yes,
I have a lot of patients from Peter Fisher as well here. Like they have been contacting from there, and he was a gem of a guy. Plus Marguerite Blackie, the niece of Burnett, Elizabeth Hubbard, they have done so amazing works. Their books, even
yes,
Forbister has done so much of books. So these legendary people have actually has worked like 100 times more better than us. What I believe, by reading their works, I could imagine the level of knowledge, the level of experience they had in Royal London College of Hospital. It was amazing. It was amazing. Like I that's why I strongly recommend, like we don't have that books in a curriculum in the BHMS, but I strongly recommend those books to actually read by each and everyone. And especially the Pierce Smith books, Art of Case Taking, that's a gem of a piece, because Pierce Smith was the first to use LM potencies. So that the level of knowledge, and he has been sharing in his books, Art of Interrogation and everything, and it was such an amazing thing, and we were so astonished by reading those books. I cannot even tell you, because after reading those, it was like it was so simple. We were just complicating with unnecessary theories and biasment. It's just that you just see patient, like how Blackie wrote that by beautiful handshakes only you can find out what the constitution could be. Just a hint. I'm not saying it's a very specific, but it's an
mm.
idea to walk away. At least you can reach to the center. You would not be in a maze. There
You know,
multiple
yeah,
points. Yes.
you know the beauty, Dr. Sharma, of homeopathy. One of the beauties over and above the observation that's required is it's actually very, very simple. And one homeopaths certainly don't get anxious. You know, when a patient arrives, it's all about let's just observe and let them speak, let them give their symptoms.
Correct.
And while they're doing that, you know very well, for those who aren't perhaps aware of homeopaths, the brain is firing away, isn't it? You know, oh, let's you know, remedies come into the brain, and you're deciphering and you're thinking of different remedies, and sometimes the patient says something else and you go towards some other area and then it comes back, and it's
I
all a
have a
process,
I
you know.
have a solution for that. When the homeopath gets occupied, you just take a piece of paper and what this Professor Vitholkas used to say, because I have been student of Professor Vitholkas, so he used to say whenever you have a lot of remedies in the mind, just keep on writing on the paper and keep it aside. That's it.
Yeah,
don't
that's
don't
actually
don't just
very
look
good.
at it.
Yes.
Just don't
Yeah.
look at it.
But yeah, you know, with the he's going to ask you from LMs, we move actually to the hospital
Yes,
itself.
yes.
So how long has the hospital been up and running? How many years has
It's
this
been
been?
8 years
Wow.
now.
And is this the in Odisha state is the only one which has your hospital?
Yeah, the private one. Yes, we are the only private homeopathic hospital in the whole state, and nobody else has it. There are primary healthcare centers, but they
Hmm.
use conventional along with homeopathy. That's what they do. But
And
there are no particular hospital of homeopathy in at least in Odisha. There is no Odisha.
and how many? What's the team of doctors that you have? Is that
I
quite a large?
team plus four staff members, 10 doctors, and plus we have a lot of interns. We have around like currently I have 8 interns with me separate. They have come for clinical training from around the India, from Hyderabad, from Bhopal, from Indore, from Mumbai, from Nasik, from near Bangalore,
Wow.
Vijayawada. So around the country, they are here to just learn, and they have been so immense grateful students that they have been working day and night to be a better homeopath. That's the best part, because see, everybody doesn't have a zeal. They just want to be, they have to just want the plate to be served in front of them. So this is not the homeopathies. You need to develop your own art and skills, because everybody has their own perception and everybody has their own individualized power to understand things.
Hmm.
So they have to just work on that, and then you see their own perspectives.
So I see it's very much an international teaching hospital as well, isn't it? You
Yes,
know,
yes.
and I think that's so commendable. You know, honestly, thank you for doing this, because it's a big deal. You know, and the fact that we need, to be honest, I'd say we need so many more, and may that day come when
True.
every country has, you know, within easy reach one day, you know, that they have homeopathic hospitals. I think it's so important. How is life in the hospital? Do share.
It's very tough when you have a patient in front of your head, because my hospital and my house is just opposite to each other.
So you at least you can go home for a cup of tea.
Correct. So
Okay.
that's the point. And my father had this immense idea. My father is also a homeopath, so he has immense idea that we have to do something for homeopathy. So he just told me that let's build this and we just show the world what we can do. So he has been a strong supporter, and he was the one to always push me that Jitesh, you need to go better places, you need to learn from everyone. So I'm very grateful to my father, Dr. Deshlok Sharma. He has been always pushing me to work hard, and because of that I am today with you. That's what I believe, that has made me reach. And till now I have been trying to improvise myself that how much more better we can do. And we are meeting like-minded people like you, like there are many people have actually doing much better in homeopathy, and that has to be spread.
Mm.
It should not be contained in a can here, in a small can. Like it should be spread everywhere, that yes, we can do something, because the more we speak, the more it is heard, and the more it is spread. so
Absolutely.
so, so
I,
it has to be like that.
mm. So what are the next thing I was really going to ask you was, what type of, I mean, I'm sure I know already the answer, but for the knowledge of the listeners and those that will listen back, obviously, to
Yeah,
this Insta
yeah,
Live
yeah.
when it's posted up here and on YouTube. What type of conditions, are there any prevalent types of conditions that people come in with, or is it just a total mixed bag every day?
It's a totally mixed bag. Like I don't know what, I'll tell you very honestly what happens in my hospital. In the morning, if I start seeing a chronic kidney case, definitely by afternoon I'll get more five patients and two new patients of chronic kidney case. I don't know how it happens. So every day it become a day. Today we see a lot of CKDs. Today lot of acutes of cold and cough. Today
Mm,
we see a lot of diabetes. Today we see a lot of neuropathies, or today we see some brain diseases like Alzheimer's, dementia,
mm,
schizophrenia. So it's a very mixed bag. You don't know what is going to coming next. Like I have shared a case of temporal lobe sclerosis in my channel. If you see in Instagram, that case was like I didn't expect to him like he should be so well, but it was amazing. Like touchwood to homeopathy. Like and we are grateful to Hahnemann that this what science he has gifted to us for humankind. Like it's so it just cannot be expressed in words what he has given to us, that gift. So in that case, that case, the patient used to have a focal seizure and he used to faint, and his father told me it is not assured that when he gonna wake up. He may wake up like 2 3 days after, or 4 days after, or in the next hour. So I was thinking how to take this case and how to. So luckily when luckily one of my assistant doctor, he just went and he just smelled him. He gave some alcohol in his nose, the smell, and something happened that triggered him. And then he woke up at the sudden. I started crying, sobbing, deep sighing, sobbing. He was so much of sobbing that he could not even stop for a second, and it keep on cursing everyone that I don't, nobody loves me and everything. And I straight away gave Ignitia LM 0 by 1. 1 month I continued with him, and the second month again he came. He was much better speaking. He didn't went to the relapses, no seizure at all, completely free. He just complaining about a little bit discomfort in the chest, but that was completely hysterical because he was taking a blanket above his face and he says that I cannot breathe. So this is not possible.
mm,
So it was completely hysterical picture. I again scaled up the Ignitia, and in the third visit he came all of a sudden and sitting in front of me, and he was just laughing and talking like, and my assistant was, sir, this is the same patient who came in ambulance. I said, oh my God, he's the one. And I like, what happened? What just happened? Like he couldn't even walk. He couldn't even like even take breath properly, and that guy is absolutely well of homeopathy. Then I believe there is so much we have to dig deep about homeopathy. There's so much to discover. They have so much of miracles of its own, but it's totally depends upon what patient is coming, and
mm.
patients are the best teachers. What I can say, they only teach us the mathematica well. Nobody else can teach you so well what patients do.
You know, you somebody just commented as because as we're talking, the comments are coming up and who's joined, and somebody said that your zeal is infectious almost, words to that effect. So um and it's very much I'm getting excited because I love homeopathy, and with the work that I'm doing, and I live and breathe it. So it's so nice to feel that energy from yourself as well. It's brilliant. I'm loving it. you know you mentioned Hahnemann, and isn't it amazing that a person who moved more than 30 times in his lifetime, who suffered extreme persecution, he was a victim of persecution and
Persecution.
slander and everything else. People would take he would they would mock him, you know, for so many things, because of homeopathy. And because he was so God fearing and because he was so humble as a physician and he truly loved humanity, he really wanted to help them, that he left us with this gift. 99% of other people would give up, wouldn't they? They'd think, my God, I can't take this. This is like everyone's against me. I have to move house again. again and again. And but what a gift, you know. So yeah, you know, it just really got me thinking as you said that. And only today we are seeing some incredible things that we perhaps didn't know about homeopathy. It's homeopathy is like medicine. It's always going to be there. It's medicine for the future. It's progressive medicine, isn't it? As we know more, more and more conditions are very easily treatable. Yeah, already they are, to be honest. That's how we are. It's always been there. But as I mean, as far as new diseases, although we don't treat disease, but I mean for those, you know, as far as living in modern ages are concerned, everything is compartmentalized, isn't it?
True.
But it's so important what's up here, isn't it? In the mind, the emotional balance is so key.
So so that way it is. If you think of more of pathological symptoms, you will lose the essence of the case, and you won't see the bigger picture out of it. Like something unique and peculiar every patient has. It's just about how much skill you as a person, as a homeopath, you have that art to extract the right information from the patient. That is where the crux lies. If you win that level, immediately you can reach to the simillimum. If
Mm,
you fail on that, it becomes very vague. It becomes a big maze of remedies, and you will be confused and ultimately land up in polypharmacy. So that is the biggest problem what is everybody is having. And
mm.
I'm strongly, I strongly see a lot of complications as well due to polypharmacy and mixing remedies and everything. It's just complicating things a lot. So I think people should be more aware of using one remedy at once. That is the best part to do that. Unless otherwise, you will always see a mix of picture and mix of symptoms when the patients land up to other homeopaths, and he'll be take a mix up of remedies, and you see pulsatilla trait, you see ignitia trait, natramur, everything which comes up, and you will be confused what
Mm.
medicine given. Ultimately, you have to give him some placebo or something like that to just to get a picture out of it, the real picture, and then you start prescribing. So that's the way.
Now tell me, the hospital is open 7 days a week, no doubt?
No, we close on Thursday, but we do have a one doctor assisted for Thursday,
Right.
and rest the working weekends are the most busiest days for us.
How many patients, Dr. Sharma? How many do you see on average on a
Like
weekend, let's say?
like today we had 75. So on an average we have like 80, some days 90, some days 70, 80. This is the average we see patients.
Very, very busy, huh? Very
Yes,
busy. Amazing. And I'd love to come over there one day, you know, meet
you're,
you in
you're,
person too.
you have a home here.
So, what else are you working on? Are you also involved with teaching and doing seminars
Yes.
and
I have been involved with teaching. I have conducted a lot of courses because I'm MD homeopathy in Metro America. That was my favorite
right?
subject. So I just pursue more deeper knowledge of drugs understanding, how they work and everything. So I have been teaching into Matria only, and educating young students that don't get and read for the original literature. Don't read the new ones. Read
Mm.
the original literatures which have been published in 1900s. That is more authentical and ethical. Rest of the things are copy paste. Every next is everything is copy paste. So
It's
you
interesting.
can,
You know, mentioned that Dr. Farooq Master is on my homeopathy health podcast, which
yeah.
is coming out tomorrow. So he's on tomorrow's episode. And
I was with him last Sunday. I was with
oh,
him
really?
in Lonavala. Yes, Farooq Master Sir and Dr. Ranjan Belsare, Dr. Abhishek Joshi. His team is fantabulous, and he has a very good team. So I was with Farooq Sir. So
But he was
uh,
talking in the
yeah,
podcast. He shares about the fact that from the late 1800s and 1900s, he's got all the journals, the original journals at
yes,
home or in his clinic. And he was saying, you know, those, even he said, there's so much knowledge in those in those gazettes or journals. You know, it's just amazing. I was going to ask you, so um, as far as homeopathy is concerned, and as far as the hospital, are you looking ahead to perhaps expanding your service to humanity through the hospitals?
yeah, definitely. I'm looking forward. I need to open another one, another state of the country, and we have a lot of investors options. The people are coming that I want to invest because you're doing such a good work.
Mm,
The only thing is not able to move that as we have a base here. People are already here. so let's see how things goes, because my dad is going old. So it's everything upon me all the time. So I have to take things, so many things to take care of. So I'm just wondering, like, alone, how much will I able to take this? And let's see how things goes, because it's very tough actually to manage it everything, because I have to do
Mm,
it my own. Definitely, my dad is there, but I don't want much, because he's doing his own work, his own patients and everything, and he's almost like 65 plus
mm,
now, and he has more passion in, now he's doing his hobby more. He's like farming and everything. He likes to spend his time, because he has worked hard for these all these
mm,
years. So it's just time for him to relax and work for me. So I just don't tell him that, okay, let's see. And he also tells me that let's share, let's build up another hospital, some bigger cities, and let's expose people, because we should spread this more. Because what happens in metropolitan cities, they also have that same concept that if you take one pill and you will be like all right like the next month. So these all myths can be broken if we do the same. So
mm,
definitely we are looking forward, because that's why a reason, that is a strong reason we are getting strong investors to spend on us to open up, and so that we can train people and we can send them over there and they can run and share their own experiences. That we can do, that we can do.
mm,
And believe me, I'll tell you, whoever student has come here, I shared their stories in my
mm.
Instagram. Today only I shared one of my student for Intertrigo. She cured with Ignitia 30. Intertrigo. And
Amazing,
she's,
huh?
I'm so proud of my all students who have trained under me. They are running their clinic so fabulously. I couldn't even imagine. I'm so glad that whatever I shared with them, that has actually worked, and they are flourishing with the success stories. They are posting everywhere their success stories. See what we are doing. I'm so amazed, and I'm very grateful to them to share their results to everyone, that see what homeopathy can do. And that's what actually the real teaching is, because it actually gives you immense hope and confidence to other people who doesn't know anything about homeopathy. So this is the
Yes.
way we can improvise their thinking. And last month I was in Greece for my there was a seminar as well. There was a Greek conference in
Mm,
Athens, and there I did my book launch as well. And plus I had a good interaction with all the MD internal medicine people, and they were so astonished to read that all cases. My book has 40 cases, 40
yes.
cases, everything before after. It's called Validation of Materia Medica through Clinical Cases. I have been still in editing phase now for the final product, because I launched it earlier because I wanted a forward from everyone over there,
Mm,
and they just sent me so beautiful forward after, and I was so happy, because MD internal medicine cardiologists, they are appraising that, okay, this is the way. So now I have been collaborating, and let's see what happens in future. So we
good,
are really working hard
good. When is it
to
available?
around the world. Yes.
When is the book
Uh,
available?
Mostly I'm targeting like this before Hanuman's birthday. It should be available everywhere in Amazon and in online everywhere before this
Brilliant,
April. Yes.
brilliant. You know, you were saying about your students, and I thought, let's get them on an Insta live with yourself.
Yeah.
Let's do it. Seriously, it'd be great. And a podcast in the future.
Surely.
Let's get them all on.
So I want two people to be there. First, the Dr. Pradeep Gupta sir. He's a marvelous teacher who has guided me, has been guiding torch, and I have been learning a lot from him. He also has a hospital in Agra, and it is more big than mine. And he is also doing amazing work. So I would request if you invite him, Dr. Pradeep Gupta sir, first. Second, Dr. Ranjan Bilsare. Third, Dr. Abhishek Joshi. So Abhishek Joshi and Dr. Ranjan Bilsare and Farooq Master sir has been working very nice. So these people are very amazing, and my students. So you have a lot of guest list. They have been doing so amazing things that you need to call them, and you have to definitely be amazed. Amazing.
let's collaborate. Let's collaborate
Yes,
and let's
yes,
do it.
yes.
Yeah, yeah, yeah.
That-
You know, I'm all for that. As you know, that's what I stand for.
yeah.
Get everybody. It's the best way. You know.
No, we are actually glad that somebody has in the movement and to spread right homeopathy, aware people. Like you said, I like the tag, like voices around the world. It's so touching. Everyone, every homeopath, like billions of people spreading their voices, reaching
mm,
around the corner of the world and showing what homeopathy can do. The
mm.
best part.
It is, and the homeopathic voice is always the voice of healing. You
Correct.
know, it's always
Yes.
the voice of healing, but it's not just healing. You know, I haven't come across a single homeopath who is not humble and sweet natured and compassionate and kind, because you can't practice homeopathy without having those qualities. I'm not saying we have an ego about those qualities. I'm just saying you have to be, I've never come across anyone who's like that. They're always so humble, just like yourself. All they want to do is help people and get them better. And that's the best possible.
I
I mean, personally speaking, is the best life,
I I have a group in Telegram. There are almost 2,110 people. All are doctors around the
Mm,
world. They post cases and I tell the remedies. And it's just a help. I just advise them that where to look at. So this is a help, you can say a help forum, that where we can help our own people without any single penny. Without any
mm,
single penny. We need just, because I have worked hard. I have seen many people. I have been asking for a lot of people, and everybody just put a tag in front of me. You pay this amount, then we'll help you. So that hit me very hard as a student when I was struggling. So I made a vow that if I am coming up, I'll make sure I'll do something for the homeopathy. I'll share everything for free, what is possible.
mm.
And that's why I created a group that any queries you just post it. I'll try my best, as I'm also very busy and occupied, but I try my best to resolve them. And we are growing as a small family, more bigger and bigger day by day. So that is also a very good thing what I started as an initiative to help among the young students and everyone through our Telegram group, through a WhatsApp group, whatever the best possible. I'm trying to help them in any most easiest way.
That's so good. I think somebody's asking if you can share the group
uh, it's
link.
it's on my bio link, in Insta bio link. You can just join from there, from Insta bio link.
Yeah, so
Insta.
if you have a look at
Yeah.
Dr. Jitesh
Yeah.
Sharma, and you'll see it there, and just click the link in the bio. Yeah,
Yeah, there
absolutely.
bio, the Telegram groups and everything is there, in WhatsApp groups, everything is there.
Good. What else are you working on? Tell me.
I'm actually working on more of cancer patients and working hard to help more in a better way.
Hmm.
And I think we can oncology if
Right.
if we really hard. And so that way I'm very studying more of in onco and more of cardiology. So that's what is more bread and butter, more of focusing now as of now. And I'm also working for my volume 2. The volume 1 is getting edited, and volume 2 I'll put more 50 cases of my book. So most probably that will also I'll try to launch by end of this year. That's what I'm trying to do that. So by the
Wow.
next year, volume 2. So volume 1, volume 2. So I had my one of my very dear sir, Dr. Manish Bhatia, like Manish Bhatia. He's been always
Dr.
a,
Manish Bhatia
yes,
has been on the podcast,
yes.
and it's scheduled. So watch out for that. So he's actually been on my homeopathy health podcast. So it's
So
scheduled, and
yeah,
yeah, amazing,
so
amazing
Manish,
homeopath.
yes, like I and Manish sir was traveling, and I told that, sir, I am very interested to write a book, and he said that, Jitesh, make sure you write a original one.
Hmm.
So I said, okay, sir, then original works, then I'll share my original works. He said, yes, do that. He said that very hard homeopath publish their original work. They are more into cut copy paste. So publish what the original work is. So this is the reason which actually pushed me up to publish my own original authenticate cases with their proper follow-ups, to show the world that yes, you read cases and get analyzed, that how do you reach to that remedy, what makes you reach. And that book I have mentioned the cases, especially with the failures first, that
Hmm.
I also thought this case could be a Rustox. You also thought there could be a Rustox. Now, next what if it fails? So, how we can perceive that, and you work on a different level so that you can actually reach to the right
Hmm.
remedy. This is an art, and it has to be learned. And just to have an idea about it, you can read from my book. So that's why I'm more focused with the failures, cases of failures, which how it fails and then how you get into the right remedy. That is the main learning what a homeopath should do. I'm a kind of homeopath. If I'll see more failures, I'll try to be a better homeopath. I'm that kind of homeopath. Because what happens if you see one shot prescriptions is getting clicked very nicely, it actually makes you a false confidence also. So you always maintain a decorum or balance, that first you see more failures, then you try to improvise that how you can overcome the failure cases with the right remedy.
Mm.
I think that is what learning starts. And that then you will feel that okay, I don't know anything about it, how did it happen, so let us work hard. So this is, then art has to be learned in that form, that you first struggle with your failure cases, then only you will be a better homeopath. That's my advice to every homeopath here.
Brilliant. Thank you so very much. It's been so good to have you on, and we'll schedule part two very, very soon as well.
Def-
And we can talk about some of the cases that you've worked with, and also about the book as well. You know,
yeah,
maybe you can share some of the tips
I,
that you've already
I
published.
have podcast also. If you everyone can search Dr. Jitesh Sharma podcast in Apple Podcast, Google Podcast. I have a lot of remedies, lot of remedy differentiation in material perspective, where you get confused and you have you know it's like for example, like lying on the affected part ameliorates, that the brania comes very first, right? And even colocin, then the heart pressure amelioration, that's also colocin, McFoss, Brainia. So this everything, it have their own little importance. Colo had become more of anger temperament. Brainia is more of bilious temperament, and they're more of Brainia is more is thirsty. So this way it is Staphysagira requires cold water in spite of being thermally chilly. So this small, minute
Mm,
information helps us to reach to exact prescription. Because what happens ultimately, we forget about this remedial differentiation, and these minute points actually help us to reach the right remedy easily.
absolutely. I think we can. In fact, as you were saying that, I think we should talk about the remedy relationships actually in part two. I think that would be very good for especially the avid listener of who's interested in homeopathy in general. You know. Yeah?
So you can prepare a list of remedies and you just ask, and I'll just try my best to just give the glimpse about it and compare it. So that way it actually comes out through me because that is more convenient when you ask about remedy and then just relates with everyone.
I'll prepare a list of 1,000.
No,
Okay.
sure. If you're able to fit, sure. If you're
Dr. Jitesh Sharma, absolute pleasure to have you on today on episode 9. And you'll be on very, very soon again, and we'll schedule another one. And again, we'll talk about these remedies. So
thank you.
until then, thank you so, so very much. And, God bless you for all that you're doing. It's amazing.
Thank you.